Have you ever felt a persistent cloud of anxiety or sadness despite trying everything to lift it? What if the answer wasn't just in your head, but deep within your gut? Today, we're uncovering a surprising connection between a common stomach bacterium, Helicobacter pylori, hpylori, and your mental well-being. Prepare to learn how your gut health might be profoundly influencing your mood and cognitive function. Helicobacter pylori, often simply called H. pylori, is a type of bacteria that can live in the digestive tract. It's incredibly common, affecting about 2/3 of the world's population. Many people carry it without ever knowing, as it often causes no symptoms. However, for others, H. pylori can lead to significant health issues. It's a primary cause of peptic ulcers and can increase the risk of stomach cancer. But its influence might extend far beyond just digestive discomfort, reaching into the realm of your mental health. Before we dive into H. pylori's specific role, let's understand the incredible link between your gut and your brain. This isn't just a metaphor. It's a complex two-way communication system. Your gut is often called your second brain, for good reason. This connection, known as the gut-brain axis, involves nerves, hormones, and immune pathways. The vagus nerve, a major highway between the two, plays a crucial role. Your gut microbiome, the trillions of bacteria living in your intestines, also produces neurotransmitters and influences inflammation, directly impacting your brain. For years, the focus on H. pylori was primarily on digestive diseases. However, a growing body of research now suggests a compelling link between this bacterium and mental health conditions like anxiety and depression. This evidence is shedding new light on how gut health impacts our emotional state. Studies have consistently shown a higher incidence of anxiety and depressive symptoms in individuals infected with H. pylori. This isn't just a coincidence. Researchers are actively exploring the underlying reasons. For example, one significant study revealed that over half of patients suffering from functional dyspepsia, a common digestive disorder, were infected with H. pylori. Even more striking, approximately 1/3 of these H. pylori positive individuals also experienced anxiety depressive disorders. This suggests a strong correlation that warrants further investigation. It highlights the importance of looking beyond just physical symptoms when assessing overall health. To strengthen these findings, scientists often conduct meta-analyses which combine and analyze data from multiple independent studies. A comprehensive meta-analysis focusing on H. pylori and mental health yielded significant results. It indicated a clear and positive association between H. pylori infection and anxiety disorders. This type of robust evidence helps to solidify the potential link. It moves beyond individual study observations to provide a broader, more reliable picture of the relationship. Such findings are crucial for guiding future research and clinical practice. Perhaps one of the most encouraging pieces of evidence comes from studies where H. pylori infection is successfully treated. Eradicating the bacteria has been shown to improve psychiatric symptoms in some patients. This suggests that removing the source of the problem can have a positive ripple effect on mental well-being. In a particularly insightful study, patients who underwent H. pylori eradication therapy combined with supplementation of iron and B vitamins showed remarkable improvement. A favorable response was observed in 74% of H. pylori positive subjects. This included a significant reduction in symptoms such as apathy, anxiety, and sleep disorders, pointing to a direct impact of the infection on these issues. The impact of H. pylori isn't limited to just anxiety and depression. Infection has been linked to a broader range of neurological and psychological symptoms. These can significantly affect daily life and cognitive function. Patients have reported experiencing brain fog, a feeling of mental cloudiness and difficulty concentrating. Memory problems, irritability, and mood swings are also commonly associated. Furthermore, persistent headaches and a general sense of malaise can be part of the symptom complex. These symptoms underscore the systemic influence of H. pylori on the body. Understanding how H. pylori might influence mental health is crucial for developing effective strategies. The research points to several interconnected mechanisms. These pathways explain the complex interplay between gut infection and brain function. One of the primary ways H. pylori can impact mental health is through chronic inflammation. The bacteria trigger an ongoing inflammatory response in the stomach lining. This localized inflammation can become systemic, meaning it spreads throughout the body. Systemic inflammation is a known contributor to various mental health conditions, including depression. Inflammatory molecules can cross the blood-brain barrier, directly affecting brain function. They can disrupt neurotransmitter balance and damage brain cells. This constant, low-grade inflammation can create an environment conducive to mood disorders. H. pylori infection can also interfere with the absorption of vital nutrients. The bacteria can damage the stomach lining, which is essential for proper digestion and nutrient uptake. This often leads to deficiencies in key vitamins and minerals. Iron deficiency, for instance, is a common consequence of H. pylori infection. Iron is critical for energy production and neurotransmitter synthesis in the brain. A lack of iron can manifest as fatigue, apathy, and is considered a significant factor that can promote anxiety and depression. Similarly, B vitamin deficiencies, also linked to H. pylori, are known to impact mood and cognitive function. While H. pylori itself is a bacterium, its presence can also disrupt the delicate balance of the entire gut microbiome. A healthy and diverse microbiome is essential for producing beneficial compounds and maintaining gut barrier integrity. An imbalance or dysbiosis can lead to increased inflammation and altered neurotransmitter production. This disruption can further exacerbate the gut-brain axis dysfunction. It creates a cascade of effects that can negatively impact mental health. The overall health of your gut ecosystem is paramount for your brain's well-being. While the link between H. pylori and mental health is compelling, it's crucial to approach this information with a balanced perspective. Understanding these considerations will help you navigate your health journey more effectively. It's about empowering you with comprehensive knowledge. It's important to remember that H. pylori is not the only cause of mental health issues. Many other conditions can also contribute to similar symptoms. These include SIBO, small intestinal bacterial overgrowth, yeast overgrowth, parasites, and various food sensitivities. Each of these can disrupt gut health and consequently impact mental well-being. A holistic approach means considering all potential contributing factors. Your mental health is a complex tapestry woven from many threads. Addressing one issue, like H. pylori, might be a significant step, but it's rarely the complete picture. Given the non-specific nature of many symptoms, self-diagnosis is never recommended. Testing is absolutely essential to confirm an H. pylori infection. Symptoms alone are not sufficient for a definitive diagnosis. There are several reliable tests available, including breath tests, stool antigen tests, and endoscopy with biopsy. Consulting a healthcare professional for proper diagnosis is paramount. They can guide you through the appropriate testing procedures. Accurate diagnosis ensures that any treatment plan is targeted and effective, preventing unnecessary interventions. Addressing gut health, including the potential presence of H. pylori infection, can be a vital component of a holistic approach to mental health. This means looking at the whole person, not just isolated symptoms. It involves considering diet, lifestyle, stress levels, and environmental factors. Working with healthcare providers who understand the gut-brain axis can be incredibly beneficial. They can help you develop a comprehensive plan that supports both your physical and mental well-being. This integrated approach offers the best chance for lasting improvement. If you suspect a connection between your gut health and your mental well-being, or if you've been struggling with unexplained anxiety or depression, don't lose hope. There are proactive steps you can take. Empower yourself with knowledge and seek professional guidance. The first and most important step is to talk to your doctor or a gastroenterologist. Share all your symptoms, both digestive and mental. Be open about your concerns regarding H. pylori and the gut-brain connection. They can assess your situation and recommend appropriate diagnostic tests. Ask your doctor about H. pylori testing. If the infection is confirmed, discuss the available treatment options. Eradication therapy typically involves a combination of antibiotics and acid-reducing medications. Understanding the treatment plan is key to adherence and success. Beyond medical treatment, consider incorporating lifestyle changes that support gut health. This includes a nutrient-dense diet, stress management techniques, adequate sleep, and regular physical activity. A registered dietitian or a functional medicine practitioner can offer personalized guidance. Remember, your journey to better health is a partnership between you and your healthcare team. The link between H. pylori and mental health is a powerful reminder of how interconnected our bodies truly are. While more research continues to unfold, the existing evidence offers a new perspective on anxiety and depression. It highlights the profound impact of gut health on our emotional and cognitive states. Don't let an unseen gut issue silently steal your peace of mind any longer. If you've been struggling with anxiety, depression, or unexplained mental fog, it's time to investigate your gut health. Talk to your doctor today about H. pylori testing and explore a holistic approach to reclaim your mental well-being. Share this video to empower others to discover this vital connection and take control of their health journey.